Hitarth.
We are the co-owners of Geelong Eyecare and we'll be taking you through all the aspects of our business plan, which includes marketing and operations strategies, financial projection and implementation phases.
We believe there is a need of optometrists with a niche in pre- and post-operative care for patients from the adjacent Geelong public and private hospitals. Our target market is aimed at all ages, but our primary market is for adults aged 30 to 49.
After our consultation with the real estate agent and accountant, our ideal location is at 64A Bellarine Street, Geelong.
Optometry is a growing health industry and there is a demand for our services in regional areas, which are experiencing unprecedented population growth.
It is expected that sales will fluctuate at different times of the year. We can assume though that peak season of business will be around December, when patients claim their near expiring private health insurance benefits for products such as frames and lenses. It's safe to say that there will be a constant demand for eye testing services year round.
Our closest competitor is Kevin Paisley Eyewear. Their business model is tailored towards fashionable eyewear, stocking high-end brands such as Prada, Tiffany & Corporation, Ray-Bans, Oakley and Gucci. Conversely, our business will focus on providing clinical excellence and offer products of different price points and brands for our unique customers.
We hope to draw the attention from the in and out patients of the hospitals as well as residents of the area and surrounding suburbs. Our advertisement will focus on the promotion of our patient-centred eye care, friendly professional services, as well as our range of modern and fashionable frames. We endeavour to do this by distribution of flyers, brochures and posters in and outside of hospitals. We have also considered other forms of advertisement such as radio, local newspapers, paper drops and bus wraps.
Given the business is situated between the public and private hospitals, 7 different bus routes, a main road and a pharmacy, our trading hours will be from 9 to 7 p.m, Monday to Saturday to cater for emergency referrals and convenience of others.
The business will be managed by Nhat, who has had experience managing a pharmacy. Michael and I will be the 2 senior optometrists, as we have a Bachelor of Vision Science and Master of Optometry degree. We will share work based on roster at this point in time.
The role of the manager for the business will include things like staffing, communications, rostering, ordering new stock, training new staff, accounting and administration work. The 2 senior optometrists will be fully dedicated to the clinical aspects of the business, which include eye tests and consultations, as well as Medicare and private health insurance claims.
The premise behind our name of Geelong Eyecare is simple. It's easy to remember as our location and purpose are identified, and we believe it conveys a very professional image of our practice. In order to practice as qualified optometrists, we will acquire an Australian business number, Medicare and private health insurance provider numbers, and complete the Commonwealth Common Form of Undertaking for optometrists.
We also expect to access services from a bank manager, lawyer and an insurance broker to support our business and issues arising from practice. Our total initial business cost will be approximately $265,000, which covers the clinical equipment, showroom, tea room, utilities and marketing costs.
As we are a modern practice, we are highly flexible in meeting key sustainability considerations. Economically, additional services not covered by Medicare, such as eye imaging, will incur as a set patient fee. There will be 1 rostered optometrist on duty during the first few years of business, and after we have established a sufficient patient base, we will consider an additional consultation room to meet the demands.
Our business is built on the importance of eye care, and as part of our social sustainability, we hope to foster equal access to our services from all members of the Geelong community and greater. We will also consider building relationships with schools and workplaces, educating students and workers in workshops and vision screening opportunities.
Technology is key to business. This will allow us to do our job mostly paper-free and communicate with our patients and third parties much quicker than snail mail. The retail space will have a welcoming aura with natural lighting during the day, and when required, LED lights will be used. Water consumption will also be limited by using medical-grade hand sanitizer. All equipment will be turned off overnight.
In terms of our investment, we will seek to obtain a fixed business plan. Each of us will be liable to a capital contribution of $50,000 as per the partnership contract. Infrastructure costs will include the rent per metre squared annually and deposit initially.
These credit debit transactions to the business will be recorded in general journal entry, including the loans and contributions. The safety net would be our residential properties.
Service sales are estimated to be approximately 250 units per month. Also, our product sales per year is about 2,500 units. For the first year of business, the estimated net profit after tax is approximately $177,000. The second year of business is estimated to yield approximately $42,000 more than the first year.
We will also employ a 30 to 70 ratio for high and low end brands, respectively, due to the average salary in the area meeting $65,000. There will be a 70% contribution margin, and we expect the sales consultancy gross income to be approximately $440,000. In terms of cash flow, after accounting for the revenues and expenses, we expect to have approximately $234,000 in the end of the first year of business, and in the second year, $318,000. Also expect to break even after the sale of 1,300 units at approximately $390,000.
Therefore, based on these three key considerations and financial projections, we are able to make informed decisions of our business objectives.
In order to achieve sustainable development for the business, we have established a system to manage changes. This requires planning, budgeting, and ongoing monitoring performance every 6 months to ensure objectives are met.
Team and individual performance will be monitored regularly for productivity purposes. These assessments are generally related to matters such as the quality of performance, how quickly and efficiently tasks are performed, and whether they are within the business budget target.
Thank you for listening to our business proposal. Should you require more information, we'll invite you to look at our business plan.